Good afternoon, everybody. It's a great pleasure to be here and to talk to you about work, the international work of the Academy. I think you've heard quite a lot from other speakers already about the tremendous growth in our international activity as an Academy, particularly over the last few years. And our influence beyond the UK is extremely important. It's an extremely important part of the work of any academy, but our links with Europe remain an extraordinarily important part of the future strategy. Our influence beyond the UK is one of the strategic priorities, and we have a very significant work programme to take forward next year. In this programme, we focus on three critical areas, really. One is excellent science. The second is not just building, we talk about building capacity, but I think it's more than that. It's actually building about strong relationships of equivalence with many of our partners overseas, and finally, of course, Europe. So you've heard that overall in the budgets you saw, something like a third of the work, I think, overall, is now in the international arena. And if you look at how rapidly that's grown, and I take absolutely no credit for this because I only started this role less than 6 months ago, but really through a fantastic international team at the Academy, who I'd like to really thank for all their work. There has been a great growth in our activities. In the grant arena, we've now got a whole 4 new grant programmes, and those have arisen particularly from the opportunities arising from the GCRF, or Grand Challenges Research Framework, which has brought in really substantial sums, as you saw earlier, in that area, but actually forces us also to think very carefully as an academy about our international strategy and where we can really most efficiently and effectively deliver our efforts. In the policy arena, we started out with an international health lecture just a few years ago. This is now an important annual event in the calendar. But now we increasingly are undertaking GCRF policy workshops, which I'll tell you a little bit more about. And as you heard already from the President, we are supporting, we have a large grant to support the Federation of European Academies of Medicine, and we are growing our links with India. And I'm going to tell you a little bit more about some of these programs. We now have 9 staff working across the international space. Now, as part of our Excellence in Science programme, I'll just tell you a few things about that. I'll tell you in a minute in a little more detail, but we now have a wonderful AMS professorship scheme. It's just starting up, attracting new professors from all over the world. We're working with a number of academies around the world, and these opportunities keep arising. There will be a meeting later this week with the French Academy of Medicine on addiction and mental health, and I'm impressed by the number of the growth of work in this particular area of mental health. You've already heard more about that. And our Rosenthal Symposium, which will be next year. And then again, our growing links with Japan, particularly in the area of digital technology, which of course has the possibility of really transforming, or has to transform, I think, the way we practice clinical medicine. A little bit more about the Academy's professorship scheme. The aim of this is to try and attract people from all over the globe into the UK. This was just, this will be launched early next year, and we're very pleased that this has actually been funded by BAYES. It was previously called the Rising Star Research Professor Scheme, and the idea is to attract people into their first stage professorial position. They get a startup package which will be used very flexibly, and we're very pleased that Moira White is chairing the group that is developing that programme. So we hope that there will be awards of 4 awards next year, and similarly a similar number in 2020. And that allows people to take up this post for 5 years initially, and the maximum will be £500,000. And that can be used flexibly. So this is a very exciting new scheme, and those awards will be made in partnership with HEI, and that's another area where we hope, once we've got this up and running, to be looking at a further bid to the CSR for that particular scheme. So we're very excited about both seeing how that goes and to the work there. Now, the fellowship has been vocal in their support of our working more closely with the UK NAM, or the US National Academy of Medicine, and you remember their president was appointed an honorary fellow last year. And we're delighted, therefore, to see growing links with the Academy. And in fact, I think the President was over just recently, just in the last month or so. And this first, I think this has already been mentioned by Robert, but this first programme will be on behaviour change to improve health for all. That programme is being chaired by Teresa Marteau and Professor Alan Leckler. I should also sort of put out an ad for this, because online registration is now open for this programme. I think behavioural science, not just behavioural science, but the many aspects of life which influence our behaviour, have arguably, not only is there a deficit in the evidence base, but I think there's a deficit in the breadth of the evidence base, which enables us to change both individual behaviours and the behaviours of societies. And those were some of the issues which we've brought out in our Health of the Public work. So I think this will be a broad-based meeting next year, and we're really delighted to be doing that in close partnership with the US Academy. And we look forward to those links developing further through them, both through directly with the Academy, but also through the inter-academy partnership. Now, the third area is really our relationship in building capacity and building the abilities, and this is really focused primarily on work with people in low and middle income countries. And I've said I think it's more, I should perhaps have changed the slide to say building capacity and building partnerships with our colleagues in low and middle income countries. And we'll just say a little bit more about this. I think many of you will probably be familiar with the Newton Fellowships, which have been running for some years, but we now have a whole bunch more activities, including networking grants, which we held a meeting about recently. These are relatively small grants, but allow people to develop links in an area between within a number of low and middle income countries, and also links with higher education institutions here. And our policy workshops, I shall say a little bit more about, but these are all major programs which have really just been developed in the last couple of years. Now, one of the exciting programs we've been involved in is, and this is a new one, is the Future Leaders program, or the FLARE program, and this is a mentoring program. This is being done with colleagues in the African Academy of Sciences, the AAS, based in Nairobi. And this program was actually being delivered by the Royal Society. It's not being delivered by the Academy, but we are going to be supporting the development of the program, particularly through mentoring. And in a sort of independent capacity, I will be actually involved with the programme with the Royal Society, and it involves a package of training and networking. So we hope to be working closely with many of with our sister academies and with our fellows in taking this mentoring programme forward. One of the real issues that I think we've become aware of is that in many of the programmes that we've operated with colleagues in Africa, they've often, at least over the last 50 years or so, involved UK scientists going into standalone, for example, institutes and so on. Whereas I think one's now seeing a very different model developing of trying to stimulate the ability of our institutions to work much more closely with higher education and other organisations in an African context. And there are now a number of programmes being hosted at the African Academy of Sciences, including those funded by Wellcome and Gates and others, which are really trying to build these much stronger links and capacity to deliver research and to build actually long-term careers and long-term success in scientists on the African continent. Now let me say something now about our policy workshops, the GCRF policy workshops. Again, a new programme of work resulting from our bid to BAYS, and we started off running three workshops between 2016 and 18. We are going to be increasing that activity 2019 to 20, doubling it, and Helen's looking nervously at me from the front row, but I know that we'll be building the capacity to do that, and really the Academy staff have been very successful in, I think, driving these forward. You can see there that we've covered a lot of topics The one that I've attended was in the Philippines on rapid diagnostic testing. And I think really the idea behind these is that they are often built between the UK Academy and the Academy in the hosting country, but they play out across a region. So the Philippines one played out across Southeast Asia. And the trick in this all is, I think, good leadership from both academies and excellent work by the academy staff to realise that these are more than talking shops. They have to be very closely linked in with policymakers. That's their whole idea. So the Philippines one we had representatives from government and from policymakers and representatives from across the region. Each of them produce a workshop report, but as I have learnt, is that reports, whether on paper or purely in the ether on the internet, go nowhere unless you socialise them and put them out there and try and track the policy responses. And so I know the Academy staff are working very hard to follow up what happens after these so that we optimise this work going forward, particularly as we're going to be taking on further work next year. And you can see some of the topics there. And this is some of the work that's going on. And you can see that these are relatively small groups that get together, about 40 people. They're hand-picked, and they really are trying to drive forward new areas. The one we did on diagnostics was all about rapid diagnostics and building also digital pathways for diagnosis and management of disease, recognising that there are actually kind of very real opportunities in some of these countries to do things that may seem more challenging here, even more challenging here, and where there are great new opportunities. We're going to do so following a very careful consultation carried out again by Academy staff and the international team. These are some of the topics for 2019. I think they're really critical areas. Epidemic preparedness and responsiveness has never been more important. We were reminded of the 1918 flu pandemic, and that actually pandemic flu remains at the top of the government's risk register. Epidemic preparedness, responsiveness, development of vaccines and public health response and clinical response, hugely important. And we'll be following up on other topics like non-communicable diseases and critically also clinical research capacity, because so many people in low and middle income countries are really up against the problem of not having the career structures to be able to follow a joint research and clinical career that I think is an opportunity we are so privileged to have here. And last but not least, maintaining links with Europe. You've heard already that we provide a lot of support for the Federation of European Academies of Medicine, FEME, through a grant we have, and this involves a range, not only the relationship with FEME itself, but with our visits to European academies and stakeholders, and it's really important to have these people as friends now more than ever. So we have a 2-year grant. You've heard that George Griffin is the current president of FEME, having previously been vice president international of the Academy. And we have a number of forums that bring together events that bring the UK stakeholders together. We do have this as a conduit into other European organisations and the European science advisory mechanisms. These are really, really important relationships at this time, and I think it's fair to say that the Academy's work with FEME has really begun to build their capacity to operate as trusted advisors across Europe and to bring the European community together over a number of areas. And we have been very fortunate with FEME in that, actually I think really George has worked very hard on this, George Griffin, to have a position statement on the European Commission statement offer proposals on Horizon Europe. So we work closely with them on aspects of Horizon Europe. And also working with them, this paper is really important, is the one on safeguarding European medical research post-Brexit. And I would quote from what was written in that paper, is that they wrote this safeguarding statement, and they said, now, as the UK prepares to leave the EU, we must ensure that the close and productive relationships between researchers is protected and preserved in order to address a shared aim of improving the health, safety and wealth of patients and citizens throughout Europe. And I think you will all appreciate that these are just the kind of friends we need right now. So we look forward to another exciting year of international activities, and just to reassure you that we'll continue, Robert's always mentioned it, that our relationship with FEAM and with Europe will be a really core part of that activity. Thank you.